Business Matters, presented by the Guamanian Magazine.
It was pegged by Republicans as one of the biggest drags on the national economy, and GOP leaders, including President-elect Donald Trump, made the repeal of Obamacare one of their top campaign promises. Trump takes office on January 20, but can he make good on his pledge to repeal and replace the Affordable Care Act on day one? Local health industry executive Frank Campillo of Calvo Select Care says any action would probably be more symbolic than anything else. This chart tracks the evolution of the law and is a graphic reminder of how complicated it is and how many different aspects of the industry it touches.
We're talking about taxes, the public health system, the Medicare system, the Medicaid system, the Indian healthcare system. So it's very extensive, but what they really want to focus is on the individual mandate. The Republicans feel that there shouldn't be a mandate. I think it's going to be an extremely difficult process for the Republicans to repeal without having something that they can put together on the table where they can provide equal or better incentives to individuals to have health insurance.
Campillo says, good or bad, there are now 23 million people with health insurance who didn't have it before. History, he says, has proven that once you give something to Americans, it becomes very difficult to take it away. Campillo is among the growing chorus who suggests that Congress and the new administration should focus on what's wrong with Obamacare and fix that.
Clearly, there are some aspects that are not working because Obamacare has become very expensive. The average individual that has the ability to buy health insurance is getting subsidies to the tune of about close to $10,000, and the cost of premiums and the cost of care. Premiums are derived as a result of the cost of care. The cost of care itself, the cost of drugs, the cost of hospitalization, and the cost of physician has increased dramatically during the last 6 years of Obamacare.
Campillo says polls show most Americans don't favor a full repeal, so Republicans, he says, must be careful with the changes or else it may backfire on them. The GOP-led Congress has promised to have a bill on Trump's desk by the end of February. Campillo says Guam leaders need to make sure the needs of the territories are addressed this time around.
On the other hand, Guam, for instance, which was not fully included in many parts of Obamacare, and the territories have a great opportunity to sit at the table now and start planning with our congressperson, with our congresswoman, and making sure that this time around, whatever changes are made, that we are included in the good parts.
What provisions would he like to see Guam included in?
People are going to get subsidies through the new Trump care one way or the other. I'd like Guam to be included on that, but I'd like Guam to be included in the matter that we get additional federal dollars, as we should. I understand that there may be expansion of what is called high-risk pools, with also some correlated dollars to that. I'd like Guam to be included on that. Those are very good opportunities for our island to get. You know, if we're including the new subsidies, whatever way they call them, if we are able to get more Medicaid money, because Guam is being impacted today. Guam did not get a good deal in Obamacare in regards to Medicaid.
And Campillo says if Guam were to be included in the premium subsidies, the impact could be substantial.
I am one of those that believe that about a good 85 to 90% of the island could qualify for those subsidies. And if we're able to get those subsidies and qualify for those subsidies, then more people will be insured. So if you get more people insured, correlated, there should be a savings to the overall population if we get more people insured.
For KUAM's Business Matters, I'm Nestor Lecanto.
Business Matters, presented by the Guamanian Magazine.